Thanks very much for staying with us. Time now for Eye on Africa with me, Georgia Calvin-Smith. Tonight, as Africa sees an increase in coronavirus cases, the WHO calls on governments to keep up efforts to contain the spread of the virus. We hear from the World Health Organization. Also, as numbers of Covid-19 pick up in Cameroon, families living with elderly loved ones are growing increasingly anxious. Care homes are also doing what they can to protect those most vulnerable to the effects of Covid-19. And Amnesty International says that DR Congolese leader Felix Tshisekedi has failed to support victims of police crackdowns during his predecessor's leadership. But first, Africa accounts for less than 3% of global coronavirus cases, but the continent is seeing an acceleration in confirmed numbers. Last week, the World Health Organization said that confirmed cases on the continent had doubled to 200,000 over 18 days. It took 98 days for the first 100,000 infections to be logged. Many African nations made a mammoth effort to quickly bring in lockdowns and sanitary measures to prevent the spread of Covid-19. But the economic cost of that has been enormous, with poorer communities bearing the immediate brunt. On top of that, health workers are strained, and there are fears that the health crisis could deepen, even as coronavirus restrictions are eased across the continent. For more on this, I'm joined by Dr. Mary Stephen from the WHO. Thanks very much for speaking to us, Doctor. But first of all, the explosion in cases initially predicted for the continent still hasn't quite happened. Does that suggest at all that the risks on that front have lessened?
So the outbreak, as you can see in Africa, it continues to evolve. So we haven't seen the peak of the outbreak on the continent yet. The number of cases is being driven by about 10 countries on the continent. But this does not mean that the risk is low or it has completely gone. We have to make sure that we continue to implement these public health measures: early detection, testing, isolation, treatment of the sick, and contact tracing, as well as the preventive measures of keeping at least 1 meter distance away, hand washing, respiratory etiquette, and where it is not necessary, really, not to find ourselves in places with a lot of people, unless it is absolutely necessary to be out there. Because if you allow the outbreak to spread, it means that it becomes much more difficult to deal with.
In terms of people circulating amongst themselves, we're seeing restrictions gradually being lifted in places across the continent. In South Africa, for example, the country with the most cases in Africa, how do you expect countries to do that balancing act between allowing people to start going back into society in order to mitigate the economic cost, whilst also maintaining the sanitary awareness needed to stop an explosion in cases?
Yes, so it is important to engage the community. So the fact that they need to understand the fact that the lockdown is being eased in gradual phases does not mean that the risk is no longer there. So they have to understand that, such that if they are allowed to go out, it means that they all have a responsibility to make sure that they are observing this 1 meter distance, to make sure that they are observing the hand washing, the respiratory etiquette, wearing of their non-medical masks in places. And also from the government side, as we continue to ease this lockdown, we have to ramp up all the public health measures of making sure that we have a robust surveillance system that is able to detect cases early enough, and any escalation of cases in places that are not already affected. The issue of testing, especially at the lower level, decentralizing these capacities and having capacity to manage these cases, to contact trace and isolate the sick from the public. So because if you do that, then you limit the exposure of vulnerable population to the virus.
And what do you think that Africa's priority should be in terms of trying to stay ahead of this, bearing in mind also the cost of the economic cost of what the measures that have been brought in so far?
Yes, so we have to strike a balance. Like you said earlier, the context in Africa is slightly different for several reasons, and so we have to strike a balance between maintaining the public health and livelihood of people. So this is what Africa needs to do, but there is no one measure that works alone. So the whole spectrum of these measures has to be sustained and implemented in an aggressive manner. Like we said earlier, we have to be able to dictate these cases. We have to test them. We have to isolate. We have to treat the sick. We have to contact trace. The population must observe the preventive measures as well. And this way, then we can be at least confident that we can go ahead of the virus. But if we allow complacency to set in, then we might.
Dr. Mary Stevens, I'm terribly sorry. That is all the time that we have. I have to cut you off there. But thank you very much for giving us your time and giving us a bit of an overview about some of the challenges ahead of the continent as it tries to stay ahead of the spread of COVID-19 as numbers continue to climb. Well, in other news, Cameroon is one of the countries that's seen numbers of coronavirus cases pick up. Almost 10,000 people have officially been diagnosed. Families with elderly members and care homes are doing what they can to protect those most vulnerable, but it's tough going. Indira Ayuk reports.
Richard's 83 but has recently picked up some new habits. He now routinely washes his hands several times a day. Florence is meticulous in following the recommended precautions to prevent the spread of COVID-19. She runs the Center for Alzheimer's patients in Douala. Many of the residents are at high risk of becoming severely ill if they catch the virus.
Every morning after helping them shower, we change their masks, we wash their hands because they touch everything. If I wake up one morning and an elderly person catches the virus, what do I do?
About 20 elderly patients are staying at this Catholic hospital on the outskirts of the city. None are allowed to leave their dormitory and visitors have been banned. But the isolation brought in because of the pandemic can be tough. 76-year-old Jean-Marie has been treated here for mobility issues. But for the past 3 months, he hasn't been able to see any of his children.
Papa, comment tu vas? On est inquiet pour toi ici. Tu vas nous revenir quand? Autant de questions. Et moi-même, il faut un moral très fort.
Douala has registered some of the highest numbers of coronavirus cases. There, most elderly people live with their families. Ida takes care of her fragile 82-year-old father. She had to take him home because she could no longer afford to pay anyone else to take care of him. Painfully aware that he is unlikely to survive if he caught the virus, she's tried to keep him confined to his room, but he's resisted.
The situation is unbearable. In the morning we argue. In the evening when I even come with his food, he is still mad at me. He wants to go wandering about. He wants to walk around, no matter what.
Cameroon has now logged around 10,000 cases of coronavirus with over 276 deaths. The numbers continue to climb.
In other news, in response to Zimbabwe's economic crisis, which has seen inflation soar by 785%, the government has upped the wages and pensions of public servants by 50%. They'll also be paid a COVID-19 allowance of around $75 a month. The relief payments will last for about 3 months. South Africa's beleaguered national airline may have a shot at a business rescue plan, but it will cost the government around $580 million. South African Airways was taken over by administrators in December after a decade of losses. It hasn't made a profit since 2011 and has already burned through more than $1 billion worth of bailouts over the last 3 years. And Malawi's president has kicked off a nationwide campaign ahead of next Tuesday's polls. They are a rerun of elections last year. The original vote had returned President Mutharika as victor, but those results were annulled in a landmark legal case when challenged by opposition leader Lazarus Chakwera. He lost by just 159,000 votes to the incumbent. Well, rights group Amnesty International says that DR Congo's president has failed to deliver justice for the victims of police repression who were attacked during his predecessor, Joseph Kabila's leadership. Following his election in January 2019, Félix Tshisekedi went on to form a coalition with Kabila's party. Clément Bonneau and Juliette Dubois report.
During the last years of Joseph Kabila's presidency, several demonstrations were violently put down by the police. According to the constitution, Kabila should have left power in December 2016, but he stayed on for another 2 years. In its latest report, Amnesty International says at least 320 people were killed during protests between 2015 and 2018. One of them was Benjamin Badibanga, who was only 18. His mother told us how he was killed during a protest 2 years ago.
Basoda wana baye babeti ta babomiye ba memiye bazokene ne hôpital lisate koshara ti ekiti awa ere kiti a docteur alobi il faut bo meme na nani na Saint Joseph eloko moko te basali eloko moko te polisi yango pe amonani te balobi akima me bamona kaye na nzela.
Amnesty International says Félix Tshisekedi, who was elected 18 months ago, has not kept his promise to deliver justice to the victims. The presidency did not wish to comment Amnesty's report. But this is what Tshisekedi told France 24 last year.
Qu'il n'y aura plus de citoyens au-dessus de la loi. C'est la justice que nous voulons renforcer, et donc par la justice, l'état de droit.
Since he was sworn in, Tshisekedi has authorized the return of certain exiled opposition leaders, and he has replaced the controversial head of the intelligence service. But his critics say that if crimes from the Kabila era are not being prosecuted, it's because Tshisekedi has too many links to the former president. Currently, most of his ministers belong to Kabila's political party.
Well, that's it for Eye on Africa. Thanks for joining us. Do so again. Take care.